International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
My name is Ingrid. I'm speaking today on behalf of a team of co-authors and also from the perspective of a decision maker in a large health services delivery organization in Winnipeg, Canada. The research in our article addresses a gap in the literature on effective partnerships between decision makers and researchers. Few studies look at these partnerships from the health system perspective, and we also provide practical guidance for three audiences: researchers, funders, and decision makers, to maximize the effectiveness of these partnerships. The research is based on a true partnership that our organization entered into with a team of researchers to apply for a large funding grant to address a system-wide issue that mattered to us. Such larger scale system priorities are becoming more and more pressing for health services organizations and usually involve system-wide and transformational thinking with multiple stakeholders. We entered into a collaboration with a team of researchers that we had an established partnership with. They were open to working with decision makers and on priorities of the system. And we received funding from a National Health Services funding organization for team development. And there was organizational commitment to time for decision makers to participate in the grant application process. Some key findings that our article presents are as follows. Decision makers are committed in principle to partnership research and its advantages. But despite this commitment, they continue to be skeptical about funder and academic commitment to it. Second, our differences in perspectives and roles among decision makers are as important and as relevant to understanding as are the differences between researchers and decision makers in these partnerships. The third key finding is a relationship broker function may be a more useful strategy than knowledge broker for addressing these challenges. The practical guidance for operationalizing effective partnerships for three groups is as follows. For funders, we urge to continue to prioritize and develop mechanisms to determine the extent to which there is true partnership among decision makers and researchers in supporting grants, and also to continue to support team development and planning grants. For researchers, we recommend demonstrating in practical ways awareness of the expertise that decision makers have and create an environment of mutual respect and shared decision making throughout the research process. We also recommend identifying a relationship broker role to help navigating complex relationships in these partnerships. And lastly, for decision makers, we recommend proactively determining research priorities of the organization when thinking about entering into partnerships with researchers and initiating partnerships with research teams who are willing to engage in authentic partnerships. We also recommend proactively developing criteria to select projects that are appropriate for engagement with researchers. Thank you.